Hello, everyone. This is Dr. Soma Latif Usman. I'm presenting this title, Growth and Development, which is related to the orthodontic treatment. In my presentation, I will be talking about growth, growth pattern, variability, and timing. I will be talking about methods for studying physical growth, measurement approaches, experimental approaches, genetic influences on growth, nature of skeletal growth, sites and types of growth, theories of growth control, and finally, social and behavioral development. First of all, we must know why growth and development is really important for us as an orthodontist. This title is highly important because we should know how the facial structures, how bone is growing, and at what time growth spurts are starting and ending, because this affects the treatment plan and the appliances that we use for the case for the patient. Now, let's talk about growth and let's talk about development, and let's talk about the differences between each of them in order to understand it. Now, what is growth? Growth usually refers to an increase in size or number over time, usually through cell division and multiplication. So growth is an increase in size. When a child is coming to life and is growing every month and every year and is increasing in size, in height and weight, this is called growth. And this usually happens by cell division. While development is increase in maturity and complexity. Development is used almost always to refer to an increase in complexity and organization, the process of an organism becoming functionally mature and able to perform all the tasks it needs to survive and reproduce. So development is an increase in complexity. When the child is starting to learn to speak and starting to learn how to eat and starting to learn how to walk, this is called development. This is in general, while also in organisms, for example, when the child is growing and the digestive system is growing and stomach is becoming able to digest and process all the types of food that the baby is eating, this is called development. While the growing of size of the digestive system of the stomach and intestine themselves is called growth. So growth is largely an anatomic phenomena, while development is a physiologic and behavioral. When we talk about growth, we must know growth pattern, growth variability, and timing. Now, what is each of these terms? What is pattern? Pattern is that there's a difference in the relative rates of growth between one part of the body and another. Different parts and organs of the body grow at different times and to different extents. And this is termed as differential growth. So pattern is that, for example, brain growing to a specific extent and in a specific time, while kidney is growing to a specific extent and in a specific time. For example, head is growing to a specific extent and stops. So it grows to a specific extent and in a specific time, while limbs are growing to a specific extent and in a specific time. What we mean by that is pattern aware. کا هەر یەکێک لە پارتەکانی بەدی بۆ حدێکی دیاریکرا و گرۆث ئەکەن و جیایە لە یەکتر. یعنی بۆ نمونە هێد بۆ ئەگەر هێد بۆ نمونە 10 سانتیم زیاد بکات ئەوە مەرجنی لیمپیش 10 سانتیم زیاد بکات بەڵکو بە حەدی جیا growth ئەکەن و بۆ مودەیەکی دیاریکراوە. This pattern is reflected in two things. Those are cephalocaudal gradient of growth and Scammons curve. Cephalocaudal gradient of growth and Scammons curve. What are each of these two? These two things are trying to explain what is pattern of growth. Now let's talk about each of them. This is cephalocaudal gradient of growth. According to cephalocaudal gradient of growth, when a child is in the mother's womb, in the intrauterine life, the size of the head is 50% of the total body, while the size of the body is 50% of the total body. When the child comes to life at birth, the size of the head becomes almost 30%, while the size of the limbs becomes also 30% of the total body. When the individual becomes an adult, the size of the head becomes 12% of the total body, while the size of the legs becomes 50% of the total body. What does this mean? This means that there is more growth of the lower limbs than the upper limbs during postnatal life. All of these changes, which are part of the normal growth pattern, reflect the cephalocaudal gradient of growth. يعني كاتم نالك للداي كاتم نالك لسكيداي كاتي هيدي لصدا بنجاي همو لشتي كاتك لداي كبه هيد أبي بلصايسي لور لمبي شبه بلصايسي كاتك أبي بأدلت هيد أبي بلصايا دوانزا لور لمب أبي بلصايا بنجاي توتال بدي أما معناي وايا أما معناي أونيا كهيد بشوك أبيتا معناي أويا كهيد is growing to an extent and stops بلام lower limb بردوام أبيت لجروث حتى وكو باسي هيد أكاتو أبي بالصدع بنجاي total body. The normal growth illustrates that there is more growth of the lower limbs than the upper limbs during postnatal life, and there's an excess of increased growth extending from the head toward the feet. واتا أكسسك هي كلهدوا هتاوكو فيت هتاوكو برو خواروي total body بروين growth زيادة كات growth is increasing from head to toes, and not all the tissue systems grow at the same rate. For example, muscles and skeletal bones grow faster than brain and nervous system. Cephalocaudal gradient of growth is not only in body, but also in face. For example, if this is the skull of a baby, the cranium is much more larger than the face. While when this individual becomes an adult, the size of the cranium and the size of the face are becoming almost equal. The cranium becomes 50%. And from that perspective, it is not surprising that the mandible, being farther away from the brain, tends to grow more and later than the maxilla, which is closer. So we mean by that, from head to toe, as much as we come closer to the toes down, the rate of growth becomes more and becomes faster. So because maxilla is closer to the cranium, it grows less and stops earlier than mandible, which is closer or more down to the body, and that makes mandible to grow for more time and stops growing later than maxilla. Now that we talked about cephalocaudal gradient of growth, let's talk about the second one, which is Scammonn's curve. This is Scammonn's curve. Scammonn's curve is talking about the growth of lymphoid system, neural or nervous system, which is brain, general body, and genital system. And each of these curves growth is represented by a percentage. So this is the percentage of growth. And this is time from birth to 10 years and 20 years. It means from birth and being a child to being a teenager, then to being an adult. Each of these curves are representing one of the parts of the body growing in relation to time, to years. For example, lymphoid curve, which includes the thymus, the tonsils, the lymph nodes, and the intestinal lymphatic masses, is growing from birth sharply until the child becomes almost 10 to 11 years of age. And it is growing more than normal. It's growing more than 100% of its normal size. It grows to almost 200% of its normal size. Then at the age beyond 11 years, it reduces to reach back to its normal size when the individual becomes an adult. Why lymphoid tissues or lymphoid system is growing too much like that? Because the individual at these early years of life is not having any defense mechanism, not having antibodies, because he's not exposed to enough bacteria and viruses and have no antibodies enough to protect him from diseases. So lymphoid tissue is growing beyond its normal rate and beyond its normal size in order to defend the individual from the infectious diseases. But then when the individual have established enough antibody to protect him from diseases, then the lymphoid tissue comes back to its normal size at the adulthood. Now, then we go to the second curve. The second curve is about the neural system or the nervous system. The neural system includes brain, spinal cord, optic apparatus, and skull. Also, upper face, it means maxilla. Maxilla is also part of this curve, and the vertebral column. Okay, this curve is starting to increase from birth, increases sharply until almost until almost 8 and 9 years of age. And it is complexity and it is growth is very fast, that it reaches plateau when the child is only 9 years of age. It means a 9-year child is almost able to think and perform just like an adult. Maxilla is related to this neural curve. It means maxilla is growing with this curve. So any treatment of the functional appliances or the appliances that need the maxilla to be at the growing stage needs to be done at this specific age, because after this age, maxilla stops growing or will grow very slow and almost reach plateau. Then there is this S-shaped curve, which is the general body. All the organs of the body, including muscles, bony skeleton, respiratory and digestive organs, kidneys, liver, spleen, and blood volume. This curve or the general body systems are growing starting from birth, increasing fast, passing through a growth spurt until the child is almost 5 years of age. Then and stops. Then it increases slowly, just little increments of increase in size or of growth until another growth spurt starts from 11 years of age at the adolescence years. Another growth spurt starts for the child to be increased again very fast until reaching adulthood. Another curve is related to the genital system. It means the primary sex apparatus, ovary and testes, and also all secondary sex apparatus regarding voice, and all those characteristics that differentiates between men and women. So genital system starting is growing very slowly at birth until the child reaches 11 years, 10 to 11 years, and changes according to gender and changes according to individuals. A growth spurt starts when the child becomes a teenager, and increases very fast until 20 years of age or until adulthood. So, بە پوختی ئەم کێرڤانە باسی هەموو ئۆرگانەکانی لەش ئەکەن کە چۆن گرۆث ئەکەن و بە چه خێراییە گرۆث ئەکەن و هەتاوەکو چه حەدێک چه پەرسنتێجێک گرۆث ئەکەن لە بەرسەوە لە سەرەتای لەدایک بوونەوە هەتاوەکو ئەدەڵتهود، یعنی لە لەدایک بوونەوە هەتاوەکو مناڵی و هەتاوەکو تینەیجەری و هەتاوەکو ئەدەڵتهودی. یەکەم کێرڤ باسی لیمفۆید تیشو ئەکات کە لە 200 بە خێراییەکی زۆر زیاد ئەکات هەتاوەکو مناڵەکە ئەگاتە تەمەنی 10 ساڵ یان 11 ساڵ کە ئەگاتە لە 200 نۆرمال سایزی خۆی. لە دوای ئەوەوە بە خێراییدا ئەبەزێتەوە هەتاوەکو ئەچێتەوە نۆرمال سایزی خۆی لە بینی 10 بۆ 20 ساڵیە، یعنی لە تینەیجەریە. بۆچی ئەم لیمفۆید سیستمە بەم شێوەیە گرۆث ئەکات و زیاد لە حەدی خۆی گرۆث ئەکات بۆ مودەیەکی دیاریکراو بۆ ئەوەی کە پرۆتێکتی ئیندیڤیدوالەکە بکات لە دیزیزەکانی ئەو دیزیزانەی کە بەکتیریا و ڤایرەس سەبەبین لە کاتێکا کە پێشنتەکە ئەنتیبەدی تەواوی نییە بۆ ئەوەی پرۆتێکتی بکات. دوایی وردە دابەزێتەوە کاتێک کە پێشنتەکە سیستمی مەناعی تەواو نۆرمال بووە و دروستی کردووە. ئەمە بەنسبەت کێرفی یەکەم. کێرڤی دووەم باسی نیورۆل سیستمە کاتیان نەرڤە سیستم کە لە سەرەتای لەدایک بوونەوە هەتاوەکو تەقریبەن 5 بۆ 10 ساڵ کە بە خێراییەکی زۆر بە گرۆث سپێرتە ئەڕوات هەتاوەکو چایڵدەکە ئەبێ بە نزیکی 8 ساڵ بۆ 9 ساڵ برینی بە خێراییەکی زۆر گرۆث ئەکات بە جۆرێک لە مناڵێکی 8 ساڵە لە سانەوەی برینی دروست بۆ ئەتوانێت بە تاوەتی بیر بکاتەوەکو کەسێکی گەورە لە 8 ساڵ و 9 ساڵە ئەگاتە پلاتوو ئەوەستێت، یعنی گەشتۆتە لە سایە سەدی گرۆثی و ئەوەستێت. ماگزیلاش لەگەڵ ئەم کێرڤەیە گرۆث ئەکات، یعنی لە 8 ساڵ 9 ساڵ 10 ساڵ گرۆثی ماگزیلا بە تەواوەتی ستۆپ ئەبێت و ئەگاتە پلاتوو. کێرڤی سێم کە ئێس شەیپە باسی جەنرال بەدی ئۆرگانەکان ئەکات کە لە سەرەتای لەدایک بوونەوە هەتاوەکو نزیکی 4 ساڵ بۆ 5 ساڵ بە خێراییەکی زۆر بە گرۆث سپێرتی یەکەمە ئەڕات کە پێی ئەوترێ ئینفەنتایل گرۆث سپێرت بە جۆرێک چایڵدەکە کاتێک کە لەدایکە بێت بۆ نمونە ئەگەر باڵای 50 سانتیم بێت بە خێراییەکی زۆر لە ماوەی 2 ساڵی تەمەنیا ئەبێ باڵای ئەبێ بە نزیکی مەترێک لە دوای ئەوەش هەموو ساڵێک لە دوای ئەوە تۆزەکەم ئەبێتەوە گرۆثەکە و ئەوەستێت بە جۆرێکە چایڵدەکە ساڵانە 5 بۆ 10 سانتیمەتر 5 بۆ 6 سانتیمەتر لە باڵای زیاد ئەکات، ینی لە بینی 5 ساڵ هەتاوەکو 10 ساڵ ئەم گرۆثە زۆر سلۆیە. دوای ئەوە لە دوای 10 ساڵەوە دووبارە بە گرۆث سپێرتی ئەدۆڵسنتە تێپەڕ ئەبێت کە ڤیلیۆستیەکەی لە تینەیجەریە زیاد ئەکات، ئەمەش بەهۆی هۆرمۆناڵ چێنجەوە ئەبێت بە جۆرێک کە باڵای وەکێشی و هەموو سیفاتەکانی بە خێراییەکی زۆر زیاد ئەکاتە تاوەکو ئەبێت بە ئادڵت. بەنسبەت جەنیتال سیستم ینی ڕپرۆداکتیڤ سیستم کە لە بێرثەوە هەتاوەکو ئەدۆڵسنت لایف گرۆثێکی واناکات کە شایانی باس بێت، بەڵام لە ئەدۆڵسنت لایفۆ لە بینی لە تقریبەن 11 ساڵ هەتاوەکو 20 ساڵ کە بەپێی کچ و کۆڕ و بەپێی ئیندیڤیدوالەکان ئەگۆڕێت بە خێراییەکی زۆر بە ڤیلۆسیتێکی زۆر زیاد ئەکات و سرعتێکی زۆری ئەبێت هەتاوەکو چایڵدەکە ئەگاتە 20 ساڵی. ئەمە this was all about the Scammons curve. Another thing is that the maxilla, as we said, we mentioned, maxilla is following this curve, the neural curve, that reaches plateau at almost 8 or 9 years of age, while mandible is following the general curve plateau. It means mandible is growing fast until here stops and then is growing fast at the adolescent's life until adulthood. It means any change, any functional change, any skeletal change that we want to do in the mandible. For example, if a child is almost class 3 at this time and we want to treat him and stop the mandible's growth, we need to extend the treatment until adulthood because it may return. So mandibular growth follows general growth pattern. Its growth occurs until about 18 to 20 years in males. Growth modification treatment, for example, chin cup, should be extended until cessation of mandibular growth so as to prevent relapse of class 3 malocclusion due to continued growth of mandible. Also, skeletal problems of the maxilla should be treated earlier than that of the mandible because maxilla is following the neural curve while mandible is following the general curve. For example, growth modification procedures, face masks should be given earlier in life, 6 years, to promote growth of maxilla. Now that we finished pattern and we said pattern is that every organ of the body are growing into a specific rate and in a specific time. Now let's see what is variability. Variability is that no two individuals show the same increment of growth at a particular age. Each individual is unique and it can be appreciated in a standard growth chart that there's variability in height and weight measurements between different children. Some children are average growers, some are generally tall, while others are generally short. Causes of variability in growth include hereditary, sex, nutrition, racial differences, exercise, climate, and socioeconomic and psychological factors. Girls gain their maximum length earlier than boys. So variability is that no two individuals show the same increment of growth at a particular age. We have a child that's growing very fast and stops at 10 years of age, while we have another child that is growing very slow but catches up later to stop in 12 years of age. But at the end, they are both having the same height and grow to the same rate. But their timing and the amount of increase in height that they make differs from each other. This is called variability. We said that pattern is reflected in Scammons curve and cephalocaudal gradient of growth, but variability is reflected in growth chart. And to know growth chart, we are depending on height and weight of individuals. The normal variability, as derived from large-scale studies of growth of children, is shown by the solid lines on the graphs. Let's see what's growth chart. This is growth chart. And this growth chart is made for boys, the blue one, and made for girls, the pink one, because each one of them are growing to different extents. And this growth chart is reflecting the growth between 2 years of age to 20 years of age. And it is depending on weight. This is weight in relation to age. Weight in relation to age, compared to age, and height or stature compared also to age. Okay, this growth chart made on 100 children, and these children were growing from the age of 2 to the age of 20 years of age, and their measurements of height and weight were taken each year to know to which extent they have grown, and they are different from each other. Any child that's growing beyond 97%, until 97% is considered to be normal, and until 3% is also considered to be normal. But beyond that and below that, beyond 97% is considered to be overgrowing or faster than normal, more than normal. Below 3% is also considered to be abnormal. So how do we use this growth chart? For example, if we have a child, this is weight by IBS and weight by kilogram. We usually use kilogram. And this is age from 2 years to 20 years. Again, this is kilogram, weight by IBS and kilogram. So, for example, my son is 3 years of age. This is 3 years of age. And he's almost 15 kilograms. We detect the lines. This is the line of 50 kilograms, and this is the line of 3 years of age. And we put an X here. So now he's considered to be normally growing in the normal growth rate. Then after a year, I again take the measurements of weight to know if he's growing normally. Each year I take his measurements if I want to know if he's growing normally, below normal, or not. For example, at the age of 12, if I take his measurement and if I take his measurement and I see he is almost 30 kilograms, this is the age 12, the line of age 12, and this is the line of 30 kilograms, then he will be here, the X will be here. In that case, I will know that his growth rate is somewhat below normal, because this line is located, this X is located on the 5%, while the previous line was located on the 50%, and 50% was the most normally growing child. Also, I do the same thing for height. When he is, for example, 3 years of age, and I know his height now is almost 98 centimeters, so I put the X here. And I follow the line to know whether he's normal or not. And I see it is 90%, so he is in the normal range. And I follow this measurement each year on the growth chart in order to know if he's growing normally or not. So this is the growth chart, and for boys, but it differs for girls. This is the growth chart that's used in the same way for girls. Now that we finished variability, we used weight and height and growth chart for variability, and we finished pattern, and we used Scammons curve and cephalocaudal gradient of growth for pattern. Now it is time to talk about timing. What's timing? Variations in growth and development because of timing are particularly evident in human adolescents. Some children So, the most important factor of growth in terms of clinical application is the timing of growth. Timing of growth is very important for us.